Okay, it looks like we're live on YouTube. Good morning, everyone. It's Tuesday, August 4th, and thank you for joining us today for a COVID-19 media briefing update from Public Health. Today, we're joined by Acting Associate Medical Officer of Health, Dr. Julie Emili, who will provide an update from a public health perspective, and I will provide an enforcement update today. Before we begin, I think Bethany let you know last week that next week we will not have a media briefing because it's council, the committee of the whole meeting, and Dr. Ryan Van Meer will be providing a public health update on, I think it's August 11th. So that's where we'll get our update next week. You can, of course, always reach out to us if you have any additional or follow-up questions. So with that said, I'll turn it over to Dr. Emili to provide an update. Go ahead, Julie.
Thanks, Julie. Good morning, everyone. I hope you all enjoyed your weekend. So here's the update for today. In Waterloo Region, the overall status of COVID-19 remains stable. I'm encouraged to report that we had a number of days over the past week where no new cases were reported. As of this morning's dashboard update, there are 40 active cases. We've had a total of 53,314 tests that have been performed in Waterloo Region, with positive results for approximately 2.6% of all tests done. There are currently 2 outbreaks declared in long-term care homes and no outbreaks in other congregate settings or workplaces. Last week, the province announced their plans for return to school, including self-screening for symptoms of staff and students, increased hand hygiene practices, including training and hand hygiene breaks, requiring face coverings for staff and students in grade 4 through 12, and students in kindergarten through grade 3 are encouraged but not required to wear a face covering. We are reviewing the guidelines currently and will continue to work to support our local boards in the implementation of these guidelines. And we are excited and awaiting more information about the additional public health nurses outlined in the province's plan. The province has also provided additional guidance for restaurant and bars opening as part of stage 3. These settings now require that all patrons remain seated at all times, both indoors and outdoors, with exceptions to use the bathroom. And operators are now required to keep a log with contact info for a period of 30 days to support us in our case and contact management. These additional measures are welcome, but it remains critically important that patrons in these establishments continue to do their part. Including practicing physical distancing with those outside their social circle, wearing a face covering except while consuming food or drink, staying at home if sick, and washing hands often. So our case numbers have been encouraging. We know that the virus is spread by people, so these numbers speak to the value and importance of public health measures and our residents' commitment to adapting to our new normal. We all have a role to play, and together these measures are making a difference. Thank you all for your efforts. So that's it for my statement today.
Okay, thank you, Julie. I'll quickly do an enforcement update for everyone. So for the week of July 28th to August 3rd, we had a total number of 392 complaints or requests for activity. Of those, we had 330 that no action was required. So the proactive patrol visits happened, but either things had already resolved or had moved on. There were 62 visits where education and warning was provided, and there were actually no fines delivered over the last week. So that's it for the enforcement update. And for all of our updates. So now we'll turn it over to you guys for questions, and we'll start with Kate from CBC. Go ahead, Kate.
Sure. Dr. Emili, I'm not sure if you're able to answer this, but in some of the guidance for students returning to school, they talk about symptoms, if your child is showing symptoms, keep them at home, but also atypical symptoms. And that seemed to be a conversation that I was having with parents on the weekend. What are atypical symptoms that parents will have to keep an eye out for?
So when we look at the symptoms of COVID, I think everyone knows about the runny nose, the cough, the fever, shortness of breath. In kids, it can present differently, including gastrointestinal symptoms. It could be a fever alone with no other symptoms. We've been seeing in daycares, kids are sick a lot. And over the summer, we tend to see more sickness. So we anticipate with younger students, we're still probably going to see kids presenting with symptoms of an illness, and we're going to be erring on the side of caution and making sure it's not COVID. So it's not just what you think of when you hear about COVID with the upper respiratory and cough cold symptoms. We also know in some rare cases in the States, kids have presented with an inflammatory disorder. But for most parents, it's really if your kid has any symptom out of the ordinary that isn't part of like, they don't have like allergies or something else, we have to consider, is it COVID? And would they need to be tested?
I'm just wondering, I mean, this seems to be the question on all parents' minds, you know, how do I prepare my child for this? How do I prepare myself to prepare my child for this? You know, we're seeing, you know, as you said, people will have to take the kid's temperature every morning and do those self-assessments. So I'm wondering if public health has, or if you're working on sort of more guidelines for parents. I know that there's waiting on the Ministry of Education and Health, but you know, parents are kind of sitting there saying, we're a month away and we're feeling nervous.
Yeah, so I can appreciate that. This is a new normal for all of us. So we're going to have to find ways, both in our personal lives and our professional lives, and now with children in school, how do we learn to live in this new normal? And kids are going to have to get used to a different routine when they go to school, and school may look differently when they're there. And I think some of that we've been having with masking in the community, and how kids are brought into that dialogue so they understand why we're doing it. So they've seen all these people in our community with masks, and what does that mean and look like. We just received the guidelines last week, so we're very excited that they were released. We're in the process of looking through them and identifying what further do we have to do to support parents and schools. This is also a discussion happening provincially, because there's all the health units across the province and all the school boards, and how can we work together to support both the school boards and the parents. So many things you're identifying are things we're starting to work through, and we know we have a tight timeline before school opens in the fall, but we're committed to making sure we're ready, both on the part of the school boards and parents in our community and teachers.
Great, and if I could just ask one more, we saw 2 new cases today. One was someone who was 80 plus, the other one was someone in their 20s. I assume the 80 plus was the new outbreak at AR Gowdy.
Yes.
Yeah, when it comes to that outbreak at the long-term care home, do we have a sense yet of how many people around that individual will need to be tested?
So we're very early stages in this outbreak. It was just declared. As with all outbreaks in long-term care, whether or not it's a staff person or a resident, we have clear protocols of who we test. And essentially, we test who we think has been exposed and in close contact. So in nursing homes, that tends to be the roommate, like if you have a roommate, or it could be their table mates, right? If you sit together. As much as social distancing, we're trying to make sure that they aren't in close contact, but you can't always control that. And then we look at what's the behavior of the residents on that unit. Is it hard to keep them apart? And should we test the whole unit? Could it be the home? So with each case, we have to do a risk assessment to say, who was this resident in close contact with? At a minimum, we test the roommates. And then we look at, with the staff, who would we test if they were, now that they're in full PPE, we don't necessarily have to do as much testing. So we do a risk assessment for each case. And so, sorry, we're in the process of doing that now.
Thank you so much. I'm done.
Thanks, Kate.
Thanks, Kate. We'll move on to Joanna from the Record. Go ahead, Joanna.
Thank you. First, a question for you, Julie. Are there any enforcement numbers related specifically to the mask bylaw?
I think that's Julie K, right?
It is Julie
We're both
K.
Julie.
Sorry.
Let's see. I really only have the chart that's in front of me, Joanna, so it's possible I'll need to do follow-up. Sometimes the team's listening in, so I might get something as the media briefing's progressing. So you want to know if there's anything related to the mass bylaw directly.
Yeah, if there's been any more charges or any more incidences that bylaw officers or perhaps police responded to.
I think this is comprehensive for covering all of that, but
Okay.
I'll let you know if something else comes in to the contrary, and I'll update you.
All right. And then for Dr. Julie, just wondering, you mentioned restaurants and bars, and I know Dr. Wong mentioned last week that there had been some concerns expressed about people not following public health guidelines in those settings. Is that something you guys are continuing to hear? Is that related to your comments today?
So I haven't heard anything over the weekend that was of concern. I think in general, we're working closely with business owners, and they all are committed to making sure they follow the guidelines and that their business operates in a safe way. It can be challenging in bars settings, especially when people are drinking alcohol and as the evening goes on. So we're working with business owners about how to deal with those situations because as much as business owners have a responsibility, the patrons have a responsibility to follow those rules and behave in ways that don't put others at risk. As I said, I haven't heard any concerns over the weekend that have come up, so I take that as a positive sign, but we are working closely with other partners to support businesses to make sure that bars and restaurants can operate safely. At the end of last week, I believe, the province put out some more direction, I think, to address some of the concerns that patrons should be seated at all times unless they're going to the bathroom, and to ask them to keep that list of customers within the past 30 days to assist public health should we have to do contact tracing with the case.
Yeah, I imagine that would be a huge help for you guys.
Yes.
Yes.
Because I think over the past couple of months, people understand more and more what we do and how we do contact tracing. So it's only as good as the information you have about who people have been in contact with. So this will definitely help.
And in general, do you have concerns about these settings just because it is a more social environment? And as you mentioned, alcohol is often involved. Is it something that worries you that people aren't necessarily following guidelines?
I think it has the potential. If we look at what's happened in the States, there's a lot going on in bars and restaurants, and they haven't put processes in place, right? So we know transmission's occurring when you don't put safety measures in place. If we look at the plan that we have in Ontario, it's put a lot of measures in place to try and decrease that risk of people having close contact in settings. And so by having people seated, managing the numbers that are in a restaurant or bar at any time, and for business owners to be ensuring that they're following those directions certainly decreases the risk significantly. And there's always going to be some people that don't always follow direction. And so it's important that we address that as soon as possible so it doesn't become a pattern. And what I would say is our business community is very committed to working with us and other partners to ensure that doesn't happen.
Right. Yeah. I guess like if it's allowed one time, then someone else sees that and then they do that as well.
Yes. And this really is shared responsibility, right? With the business owners and the patrons.
Okay. Thank you.
Thanks, Joanna.
Thanks, Joanna. And I did hear back from my colleague, and the numbers that I provided are based on the Reopening of Ontario Act. So the regional bylaw team is actually providing mass bylaw numbers separately. So we would need you to follow up with the corporate communications team, or you can follow up with me after and I'll see what I can find out for you.
Okay. Thank you.
Thanks. And we'll move on now to Tim from 570. Go ahead, Tim.
Good morning. I've just been looking at the cases by age and reported date graph on the dashboard. Now I'm just seeing that the 20 to 29 age group is getting closer and closer to the 80 plus age group. If it passes that age group, does this mean that this age group is just not listening and they're not following the guidelines and they're just going in and out of their social bubble? And what concerns do you have regarding that?
I think there are a number of factors that drive this. And so one factor is if you think about who we were testing at the beginning versus now, it's different. So at the beginning, our testing was very focused on healthcare workers and residents in long-term care and retirement homes. So because of that, the age distribution was different. As I think it was around end of May, when we expanded testing to everyone, we started to see a change in the age distribution because of who has access to testing. As we're also reopening our economy and more people are working, who's at risk changes. And it's not just people who are in healthcare settings or working in outbreak settings or potentials for outbreak, I should say. We start to see more. With that said, if we continue to see a trend, and I think we have seen some trends across the country and not just here, that there is more in younger age groups, we have to look at, is it beyond just the expansion of testing and the fact that more people are out in the workplace? And so then we see a broader demographics of who could be impacted. With our case and contact management, we try and also identify trends, right? So when we're talking to cases and figuring out where were you in the last couple of days or in the period where you could have been exposed, are we seeing any trends? And now that we're starting to see, bars open, sorry about that. Sorry. Now that we're seeing bars open, more workplaces open, there is the potential for more congregation, especially of younger people. We haven't seen a lot of reports in the Waterloo region of parties that are of huge sizes that we've had to manage, but we know there has been in neighboring health units. So I think, Tim, it's something we have to monitor and be aware of. And I think that's part of why I think with Dr. Long a week or two ago flagged, we're starting to see a different demographic and making sure that everyone understands whether or not you're healthy and you aren't as high risk for complications or you're 80 in a nursing home. We all have to be cognizant of the fact that we can get it and we can give it to others. And so that's a trend we're monitoring. And if we were to see very specific scenarios we would want the public to be cautious of, then we would start to communicate that.
Now, going back to alcohol and this age group, 20 to 29, is public health doing any research regarding alcohol and drug use, whether or not that can increase numbers with them, the 20 to 29 age group changing their mindset while they're consuming alcohol and or drugs?
So I don't think we're doing any specific research, but I think we all know that when you drink and use drugs, you don't make the best decisions, right? So I think, we've seen it, especially in the States. Behavior associated with drinking and substance use has led to people ignoring what we would call public health advice, whether it be physical distancing, not gathering in crowds, those type of measures. So I'd expect that if we were to see that here, that's something we would want to flag through you as our media to get the message out that people have to change their behavior. Regardless of whether or not we've seen that right now, we still want people to keep cautious of the limits for gatherings, to keep within their social circle. When they're outside their social circle, to practice physical distancing, to wear a mask when they're out, do hand hygiene, all those things. We don't want to wait till we have a problem for people to start doing it, because the only way we keep our numbers low and we keep the economy open and people to live as normal life as possible is for all of us to continue those actions.
That's great. Thank you so much.
Thanks, Tim. We'll move on to Damon from the Woolwich Observer. Go ahead, Damon.
I actually don't have any questions right now. Mine were answered. Thank you.
Okay, thanks, Damon. We'll move on to Natalie from CTV. Go ahead, Natalie.
Hello, this is for Dr. Emili. Now that we know the province's back to school plan, how do you think parents should feel about sending their children back to the classroom?
So I think throughout the reopening of the province, we've always had to balance well-being and mental health with safety. And if you look at what we've done in long-term care home, retirement homes, and congregate setting, it's been about that balance. It's the same as we've reopened workplaces. So I think it's the same with schools. Schools is one more part of our community that has to be opened. And so the province has done a very balanced approach to encourage mental health, well-being, and development in our school population with being safe and sending them to an environment that's safe. And so we know that all these measures that we are putting in place in our community and workplaces have worked, and they've done a similar approach. If you look at what they've done in terms of how teachers are protected, how kids are protected, trying to cohort and limit the number of exposures, putting screening in place, masks if they're older students, that is the balance to get them back to school safely. And I think we know, and you may have seen Sick Kids' position. So Sick Kids, as we all know, is the experts in pediatrics within our province, and they are fully supportive of this. We also know younger kids aren't as likely to transmit. So it really is a balanced approach, like we've done throughout the reopening stage, whether it be getting back out into workplaces or getting back out into the community.
And as masks are being encouraged for students in junior kindergarten to grade 3 and required from grades 4 and up, how can masks be encouraged for younger students?
I think anyone who's a parent of a younger student probably understands that it's a bit more challenging to get them to wear the mask. And some of this is back to Kate, the discussion the question you had about how do parents prepare their kids. And I think it's really about, one, they have to understand what we're doing, right? And understand why a mask is important to wear. And then if they're old enough that they can wear it. We recognize that young kids are going to be taking it off, or they don't understand they have to wear it all the time. And so it's really about a parent assessing with their child, are they able to do this? Do they understand and can they wear it? And that's why the school has put in place extra cleaning, the screening protocols, and trying to cohort the students to try and limit exposure if a kid were to get infected. But with parents, it's about having the conversation with their kid so they understand why and seeing, are they able to do it? Because every kid, even though they're the same age, may be a little bit different about whether or not they can do it and understand that they can do it.
Still on the topic of masks, there is a anti-mask event that is planned for this weekend in Victoria Park. What is your reaction to events like this? And does public health plan to take any action around this gathering?
So I think the simple answer is disappointment. I think if we look to our neighbors in the South, you can see what can happen when people don't follow public health recommendations, or processes aren't put in place to limit spread, whether it be limits in gatherings, physical distancing, or masking. And what we're trying to do is really keep everyone safe and keep our rates low so we can continue to live as normal a life as possible in the middle of a pandemic. We can continue to have our economy open, people at work, kids at school. And so when people don't do those things, that's the risk, that we get more cases. And I understand not everyone has a right to opinion, but we have to think about what is our collective responsibility to each other. And that at the end of the day is what these conversations are about. Masking isn't just about protecting yourself, it's about protecting those around you, and it's about keeping our community safe as a whole. So when you hear about these things, it's disappointing, and we have to make sure that everyone understands the facts. And the facts are, we're in the middle of a pandemic. We have low rates right now, but we need to keep the measures in place to make sure the rates stay low.
Thank you. That's all my questions.
Thanks, Natalie.
Thanks, Natalie. So with that, we've gone through the list once. Oh, Damon has a question. Are there any other follow-up questions? Kate, okay, good. Damon, we'll go with you first. Go ahead.
Thank you. My question's for Dr. Julie Emili. Are we concerned for the children returning to school that can't wear masks for bullying being placed on them for not being able to fit in?
Did you say bullying? I didn't hear that. Okay. So I think, like everything, we are trying to make the message wear it if you can, right? And so I think that's part of the conversation that has to happen within the school setting and at home. The kids have to understand why you wear a mask and why some people may not. And so I anticipate there are going to be circumstances where a kid just doesn't have the developmental capacity to understand how to wear it safely. And so part of what has to happen is the conversation, right? Within the school setting and within the home. And I hope that that wouldn't happen, right? That kids would not bully other kids who aren't wearing a mask. I hope it wouldn't. And hopefully with the dialogues happening, it won't. If it does happen, that's something we're going to have to address, and how bullying happens for all sorts of reasons. And if bullying's happening about this, how do we address the bullying so that kids come to school and feel safe for whatever reason, and they feel comfortable whether they're wearing the mask or not. And if they're not able to wear a mask, that's okay, because especially in the younger kids, we anticipate they're not all going to be able to do that.
Okay, thank you. That's my question.
Okay, thanks, Damon. Go ahead, Kate.
Thanks. Dr. Emili, I just wanted to touch on something that CBC reported on this past weekend, which was a few different studies that are looking at conspiracy theories and what people are believing. And the study found the more the person relies on social media to learn about COVID-19, this was a McGill study, the more likely they are to be exposed to like misinformation or to believe what they're seeing, like somebody posts, as opposed to reading an article on traditional media or listening to the radio or watching TV. And I'm wondering whether this spurs a conversation within public health about how to address that and how to maybe reach out to people through social media. And I guess this could be for Julie too, both Julies.
Julie squared.
Julie squared. But I mean, is there a way to sort of combat that and do some kind of social media campaigning that addresses don't listen to social media, if that makes sense?
I'll start it, and then Julie K can talk about the social media stuff. So I think we all know that media has a very important role to play in getting the message out, and we rely on you to do it in an accurate way and present the facts and do it in a way that people understand the message. And that's why these briefings are really important, because we know you'll get that message out. You have responsibility as a professional, and that is where social media has none of that, right? So social media doesn't have someone that has an accountability to make sure the information is correct and presented in a way that the reader of it, or the whatever the word is, can understand. And so social media is a challenge even outside of COVID. And it's a challenge for any organization that wants to get out information that is factual, correct, and helps people to make an informed decision. So social media is a challenge. And I think, our neighbors to the south, as I reference again, that social media has contributed to the conspiracy theories, because it's not a platform that you can confidently know that the information there is correct. But it's a quick message, right? It's a quick message, and it grabs people. And if we think of all the way media works, it works against us in many senses. So that's why we're committed to these briefings with you, because you are a reliable way to get information out, and you care about the community that we live in, and you want to make sure people are informed. I'll pass it to Julie K about social media and how you manage that.
Thanks, Julie. So I would just add to that, I agree with what Dr. Emili said. I think that from the beginning, we've tried very hard to be out there providing information in a steady way, not just through these briefings, but you'll recall in the beginning we were doing these 3 times a week. We were also putting out numerous tweets and posts throughout the day to try to establish that we were the credible source to go to. And we were even saying that and continue to encourage people to look to credible sources, and we'll cite the federal government, the provincial government, and that's often where we're linking to as well, Kate. So I think that it's always a challenge, and I would agree that some of the stuff that's going on south of the border is challenging, because you see we have our highest leaders who are not being necessarily responsible with the information that they're sharing. And what I've really enjoyed about my role during this pandemic is that you'll see our leaders try to really stay in their own lanes and speak to the information that they are the experts in. So when Chair Redmond and Julie are doing media briefings, you see Chair Redmond sticking to the regional information, more of the political stuff, where it's usually public health providing, or always public health providing the health information. So, it isn't perfect, and we certainly see it, and we know that the misinformation is out there, and it's a challenge, but I think the bottom line, and what you can continue to encourage your followers to do, is always circle back to the credible sources: Public Health Ontario, Health Canada, in order to ensure that we're all on the same page and getting the same information.
Great, I will leave it there. Thank you.
All right. Any other questions? Okay, so I think we can wrap up this briefing for today. And again, just a reminder to all of you and to anyone who's listening in that we will not be holding a media briefing next week. And instead, on August 11th, there will be a committee meeting taking place where Dr. Ryan Van Meer will be providing an update from Public Health. So with that said, we can conclude today's briefing. Thank you all for attending, and I hope that you have a good week. Take care.
Bye-bye.